We have several different programs within the PCN. We've got the Health Management Clinic, which has been around since 2006, and the Low Risk Maternity Clinic, which has been around since 2007.
So the goal of the Health Management Clinic is to provide support, education, information, and motivation to patients who are looking to better manage their chronic disease.
The Low Risk Maternity Clinic is a clinic that focuses care on pregnancy and postpartum with people who are generally healthy moms, healthy babes.
I think ultimately with the programs it involves better patient education, better understanding of how to manage their condition, and as a result of that it empowers them to take greater control of whatever medical issue they're dealing with.
My name is Karen Sokol and I've been living with diabetes for just over a year. My doctor recommended the Health Management Clinic to me because of the resources that were available there to me.
So at the initial appointment with Karen, she was in a state of shock of just being diagnosed with diabetes a week prior to the appointment.
I wasn't really expecting it. So when I found out that I had type 2 diabetes, I was quite shocked, and I went for a couple of weeks of just, how am I going to deal with this? How am I going to get through this?
Karen met with myself. She also met with our dietitian, our kinesiologist, and the behavioral health consultants at the clinic. So we were able to address all aspects that are affecting her life. So her nutritional intake, getting her in an exercise program, as well as motivational issues.
For me, having the help that the team offered at Health Management Clinic was a part of making me successful. I realized that with their help and with my determination that I was going to be just fine. With
the use of the Low Risk Maternity Clinic resources as well as the Health Management Clinic resources, you have nurses, healthcare professionals who are able to champion the cause for their patients.
My name is Claire Poole. I'm a communications consultant and I have 2 daughters.
Claire Poole, lovely lady. She came into the clinic with this great energy, and one thing that was sad to see is that she started to develop migraines, and the migraine headaches that she was having really affected her every day.
My pregnancy started off normal. At the start of the 2nd trimester, I started to get headaches, which progressed very quickly into a migraine every 3 days. I was at a point where I had to stop working, and I needed help taking care of my 2-year-old because I couldn't leave a dark room.
So Dr. Brandon referred her to the Medical Disorders in Pregnancy Clinic, and they were able to get her in right away so that we could figure out with them what was the safest way to help Claire deal with her headaches.
After my care with the PCN and the Low Risk Maternity Clinic and the healthy delivery of my baby girl, it was nice to have me back, and it was nice to go back to just being a regular family again.
So anytime a patient can receive care in the community and they're being served by a multidisciplinary team that has a greater understanding of the patient's disease and what ultimately makes them tick, they have a better understanding, and therefore that allows them to have better outcomes and ultimately better patient satisfaction with the care that they receive.